My name's London, and my story starts back in 2016. I am part of the group that plays really hard. Over the years, my body took a lot of hard hits, which set up some osteoarthritis in my hip that I didn't even realize was there. And so at the end of 2015, beginning of 2016, I had experienced sort of like the tipping point. I took a really hard impact injury to the hip, and at first I didn't realize how bad it was. It was sort of like the straw that broke the camel's back for my hip. And I was at work. I'm a nurse. I work with a lot of other nurses and physicians and respiratory therapists and all of that, and they were watching me limp around like Quasimodo, and they're like, "Are you going to get it checked out?" So I went to the orthopedic surgeon and they checked it out, and at first they were kind of like, "Oh, well, we're just going to send you to physical therapy. Physical therapy's great," but I was like, that's not going to work. I'm already extremely active and I'm going downhill with physical activity. Please, MRI, X-ray. So they did all of that, and then when they realized the severity of the condition of my hip, they put me on crutches actually for 6 weeks because I had a fracture on the head of the femur bone where it sits in the hip socket, which was pretty excruciating, which is why I was walking so bad. And when all was said and done, they said, we'll give you this prescription. Nothing touched it. Narcotics didn't touch it. Anti-inflammatories were the best thing because it was an inflammatory injury. And but you can't stay on those really high, massive doses of anti-inflammatories forever. So they said, we can give you, actually we don't want to give you an injection of steroids into the joint because it's already so bad. That'll make it worse. Steroids are not the greatest. They'll give you a temporary pain relief, but they will ultimately cause more damage to the joint. And so they were basically like, when do you want your hip replaced? Just let us know when you want your hip replacements. And I get why people get their hip replaced. The pain is excruciating. 10 out of 10. You can't get dressed. You hurt when you sleep. You hurt when you roll over in bed. You hurt when you get in your car. You hurt 24/7, and it was bad. Even on those really powerful anti-inflammatories, I still had breakthrough pain that brought me to tears when I was walking and things. And I've had other surgeries and sports injuries before, and I know that you're not quite the same after surgery. Surgery's great in a lot of cases, but you're never really quite the same. And so I started looking around at what my options were, because I know once you cut apart that hip joint and put artificial components there, there's no going back from that. You can't undo that kind of a surgery. And I had people all around me that were having issues with hip replacements. Friends, colleagues, cousins that were having issues with their joints, their replaced hip joint dislocating, which is excruciating in a medical emergency. They had to get second and third hip replacements because the joints, the parts didn't work, or they were having issues with metal debris. So you can get a lot of metal debris from the joints rubbing, the artificial components rubbing together, which, now that's circulating throughout your body. Just a lot of things that I thought, I just don't really want to go down that path. So I started looking into what my options were and started checking the research, because that's what I do. I'm in nursing, I'm in academia. I've had over 30 years of experience in the hospital, and so I found stem cell, and I actually noticed that Dr. Adelson was one of the most well-known doctors in the nation with regenerative medicine. And I thought, well, he's perfect. I'll go check it out with him. And so I met with him. I was really impressed with how personable he was and the time that he spent with me, talking over everything. And basically, like, he's told lot of other people I can help. And so we treated my hip. I've had more than one treatment of my hip over that period of time, because now 2019 going into 2020, I'm hoping to be able to have a great snowboarding season again. But I've had a really great experience with the stem cell treatments that I had. It brought healing to my hip. I did have to be patient because I was worst case scenario. I mean, the severity of my hip was basically a 10 out of a 10. And so my pain now is 0. It's pretty amazing. I don't have to take anything for pain. I'm back to my physical activity. I'm snowboarding again and doing all of the other sports that I participated in, and it's amazing. And there's a lot of resistance to it, still on the Western traditional medicine side, but there's a lot of progress being made, and I think more people are open to it, and they're seeing, I mean, they see me at work now, and I know about 80% of them think, oh, well, she just wasn't injured as bad as we thought, because I'm doing so well. So that's kind of my story in a nutshell.